everyone, welcome to our channel
A couple in Germany. So we got a lot of questions on Instagram about what is the scope for medical professionals in Germany, what is the roadmap, how can they come to Germany, and also questions from students who wanted to pursue medical PG in Germany.
So to answer all these queries, we have very special guest today in our video who is Dr. Deepak Mishra, who has been working as a medical professional in Germany since 2014. Also, Dr. Deepak has his own YouTube channel where he makes detailed and informative videos for medical professionals who are aspiring to come to Germany.
So before starting the video, if you are new around here, then do consider subscribing to our channel because we make informative videos related to life, travel, study and work in Germany. So having said that, let's start the video. Thanks a lot, Dr. Deepak, for coming to our channel, A Couple in Germany. And we'd like to start with your introduction. Please tell our viewers more about yourself.
Well, first of all, I would like to thank you for inviting me to your channel. And this way I get to reach more people and share my information and knowledge with more people. So I'm very thankful for that. About me, I come from Mumbai, India. I did my schooling and junior college over there. For medical college, I had to go to Pune, BJ Medical College in Pune. I did my MBBS. I completed in 2011. And after that, I went to the USA for some time and then finally did my rural postings in Maharashtra. After that, I came to Germany and I have been here since 2014. And I have been doing my training in orthopedics and trauma surgery in Germany. At present, I live in Essen and I work for the University of Essen.
We just wanted to know, for an MBBS in India, what is the process of coming to Germany for work?
See, here, first of all, I would like to emphasize here or explain again that in India, we have PG. After MBBS, we have MD or MS in surgical branches. And after that, they work. Okay, so that means MD or MS is a part of the training. That means people receive stipend. They're not working, they are training themselves. Here in Germany, it is not like that. Here it is that you are training while working. That means your work that you do is training. That means I'll tell you about trauma surgery and orthopedics, which is a combined training program for 6 years. And if you do that for 6 years, I have been working. That means I have been receiving salary from day one. That is a normal doctor salary. And after that, after I complete my exam, I will be getting the degree of the specialist. So this is the difference between work. In Germany, work is while you are training with work it is.
So there is not this concept like you study the entire for duration of 1 year, 2 year, whatever, you just study and then you start working. That is not the concept here.
No, it's not like that. You study on your own. And after 6 years, when the duration is fulfilled, you obviously have to maintain logbooks. You have to do procedures. You have to learn things. And but there is no classes as such. So it's not a university course, basically. It is a Weiterbildung. That means you train further. You complete all the requirements for the specialist exam. You take the exam. And then after you pass it, you can work as a specialist here.
Can you explain about this process? Then what is the eligibility? What are the documents required? What are the accreditations, if any?
Yes. So I will, from the previous part about the process, what they should do. I'll go one by one, step by step. I have made many videos on my channel about this. I also have a online course which mentions everything in detail. But I will go step by step. I'll tell you if someone is a doctor in India or any other foreign country for that matter, a non-European country, doctor or dentist. When I say doctor, it applies to dentist as well. Okay, so everything is same for both of them. Only the exam, the content of the exam is different, obviously. So for a foreign doctor who is working in India or doing his internship, what he needs, the documents that he needs are the basic academic documents. That means the mark sheets. He must have completed his curriculum, obviously, he must have passed all the exams. He must have done his internship. He must have received his medical license. That means one has to be a doctor. See, one is not a doctor before he receives his license to practice. So one might say that, okay, I have done my 5 years and 5.5 years of training, but not taken the exam to get the license. Then he is not considered a doctor. Okay, so to apply to Germany, you have to be a doctor. That means your complete training has to be completed. So course, internship, license. License has to be there. Okay. After one has these basic requirements, one requires a transcript from the college, university. That is not a big deal. Every college offers a transcript. They also require curriculum from the university. That is also common. So these are not something that is like very difficult. These are simple things. What are difficult things are those that they have to complete the language course. Okay. Now the language course in itself takes around 6 to 8 months time, because it has to be completed till B2 level is mandatory. That means you start with A1 level, A1, A2, B1, B2. And B2 is mandatory. Only then your application, that is mandatory for completion of your application process. C1 is preferred. If you have C1, it's good, because the employer, the place where your application will go, they will prefer you in comparison to other candidates. But if you don't have that, it's okay. But B2 is mandatory. So these are the, along with other basic documents, academic documents, language requirement is there. And with this, one can apply to one of the states in Germany. There are many states, and each state has their own approbations office. Approbation is the permanent license. That means the licensing authority, basically. So one has to first of all choose that which state one is going to apply for. Okay. So that decision is very crucial, because the trends change every couple of years. I will give you an example of state like Northern Westphalen, where we live. Here in Northern Westphalen, the exams are more difficult in comparison to a state, for example, Bayern, where the exams are okay. That means that is a negative point of Northern Westphalen, but at the same time, there is a positive point that the application process is a little faster. The documentation work. So this is just one example. There are several factors about several states which one has to take into consideration. For example, the state of Rhineland-Pfalz. Rhineland-Pfalz is very, I would say, easier state in comparison to these states. If you take that easier route, you will not get a job over there, because it's a small state, less hospitals. So everything is about demand and supply, and for this reason, one needs to do their own research, good research, to find out which state they're going to apply to. Once you have decided, then you have to send that application. All the websites have those application forms, or to download those forms, print it, sign, fill the forms, and along with the documents that I have mentioned, you send it to that licensing authority. Now, the licensing authority will go through all the application, and they will send you a letter where they will say that, okay, look, you have sent us documents XYZ. Now documents ABC are missing. So please send us this document ABC. Now this letter that they have sent to you, now this letter is called Deficitbescheid. Many states do not write, there is no heading like Deficitbescheid. It is just this letter where they say that this is the deficits. These are the missing points. Okay. Now, what happens is that through our Facebook groups and through Instagram, I get lots of queries, because me and my consulting company, we don't do any other deal in any other educational businesses, only for doctors and dentists, sometimes nurses who want to work only for Germany. It's a very niche branch we are in. And that's where even then we get so many queries, and people ask that, okay, I'm going to apply for Deficitbescheid. I say, no, you don't apply for Deficitbescheid. You're going to get it as it is. You apply for approbation, you apply for Berufserlaubnis, that's the temporary medical license. So that you do. For Deficitbescheid, you don't have to apply it, you will get that as it is. So, yeah, once the Deficitbescheid is there, then you fulfill their demands, whatever documents they are asking, give it to them. Then they will invite you for the Fachsprachprüfung course, temporary license course. So this temporary license is mandatory to start work as a doctor. So without that, you cannot get any job contract as a doctor in Germany. So all the earning and all the salary and everything, all the work permit, that starts only after you have the temporary license.
One is having temporary license, so that person can do a job, or that person needs to do internship in hospitals?
No, you can, with temporary license, one does not need to do any internship. One can start, one is authorized to start working, one can work, one will receive salary for that. Only thing is that this work that he will be doing will not be counted as a training. Okay, so 6 years duration that I said, that is after approbation, after permanent license. That means one can start working at a place, keep working, and for 6 months, 8 months, and then take his approbation exam, that is a knowledge test. And the day after that, the duration is counted as training. Before that, what he did, he learned, he gained experience, he earned money, but that was not the academic training.
One question here, you mentioned about the German requirements. So we have multiple visas to come to Germany. So let's say that someone wants to come to Germany on the language visa, and let's say they learn up to B2 or C1. So then can they apply for approbation and convert their visa? Is that possible?
Theoretically, yes. Theoretically, there should not be any reason why not. People, a couple of years back, people were doing, that was a normal trend actually, a couple of years back. When we started a consulting company, this was a trend going on that everyone was doing this. And from the consulting companies, those were already there in India. The problem was that the embassy then stopped giving these language visas. Now see, I will have to explain you the perspective, the reason why that happened. What happened is that in India, I mean, from all the consulting companies, people go that, okay, when the NEET exam is an entrance exam for the post-graduation in India, right? When the result comes, people don't get the desired seats and receive less marks. Now then they look for options, right? Where to go. Now somebody tells, okay, Germany is also a new trend. Let's find out. Then they search internet that, okay, which are the consulting companies? They find some consulting company. They go over there. Now they tell that, okay, no problem. We will send you to Germany. You will start doing, they tell them that, okay, this is a salary, all the nice things they will hear. Now they also start learning the language over there. Fine. A1, A2 level. Now, just to start. But what happens is that what used to happen that time is that this consulting companies had tie-ups with the language institutes in Germany, and they received commission for that, obviously. So the language institutes thought that these are the Indian or any other foreign consulting company, and they are sending their candidates to Germany, and the language training is our responsibility. We will train them for the language. Okay, this was the thought of the language training institute. The consulting companies in India thought that, okay, we are sending the candidates to Germany, our role is finished. Now further, apart from that, they have to do on your own. And candidate thought that, okay, here's a German institute, here's an Indian consulting company, they both are taking care of me, so I just have to study. I don't have to do anything else. So this was the miscommunication because nobody knew. In Germany, the institutes did not know what was promised in India. The person who was promising did not know how is the pay. He did not know about Deficitbescheid, about these documents, the consulting companies. And so this came to notice in Germany when people went to do their visa extension that, okay, my 6 months are finished. Now I want to extend my visa. The visa officer used to ask, yeah, okay, then, I mean, have you applied for your Berufserlaubnis or approbation? Have you sent your documents to the, say that, no, I have just finished my B2 yesterday. How do I then said that, okay, no, we cannot extend it like that. And then this entire nexus slowly and steadily came into picture, and then they stopped it. He said, no, the reason why they want this Deficitbescheid is that when you have a Deficitbescheid, that means your documents are already reached. Okay, documents are already reached to the authority. That means somebody in the authority has gone through the documents and have told you that, okay, for this doctor, out of 10 documents, 5 documents are there, 5 are not there. Still, you know that 5 are not there, and then you are applying, then you are coming. So you're not in the dark. So this is the background about why the process that you said that, okay, someone can come for language visa and convert it. Theoretically, nothing wrong in that. But the question is why? You have language institute in your country as well. Why don't you do it there itself? You can save money. You can save time.
So basically, which visa the person gets then for coming to Germany?
The most correct visa, a standard visa, is the visa 16D. It is called according to the paragraph of the German immigration visa laws. 16D. It is called the visa for recognition of professional qualification. So it is the maximum of 18 months. Initially, one gets 3 months visa, but it can be easily extended when they have enough reasons and enough funds. Another one is that when someone wants to come on a short term, just to check how the system is, just to get some elective, some hospitation, some hospital, then the Schengen visa, the tourist visa. But that is not recommended because it's a very short term visa, so you cannot achieve anything in that short period of time.
But this will come only when one gets Deficitbescheid, right? So the question is that if, like in the Deficitbescheid, there are 2-3 deficits. So should the candidate first satisfy those deficits and then apply for visa, or how is it?
No. See, first of all, it is not mandatory to have Deficitbescheid for visa. Okay, they prefer it, they want it, but many cases have been so that if you have Eingangsbestätigung also, that okay, documents have reached over there and they have sent the confirmation that okay, documents have come, that is also sometimes accepted. Okay, so it's not 100% mandatory. Obviously, chances increases very significantly if you have Deficitbescheid for acceptance of visa. That's one thing. About what is missing, that the visa officer is least bothered about. Okay, so because those are very complicated things, visa officer has no idea about those things, right? So those are complicated. If the Deficitbescheid directly mentions that okay, your training, for example, people who do the training in foreign countries, Indian nationals who have studied in, for example, in China or any other Philippines. So I'm just naming this couple of countries because problems have been come into have noticed problem with these applications. But it can happen to any other country as well. So there's some misunderstanding, sometime miscommunication, sometime. So if that is clearly mentioned in your Deficitbescheid that okay, your training, we do not recognize it. Okay, we do not value this as a medical training, then obviously the visa officer will go through it and say no, it's not, they're not accepting it, so you have to clear it first, then you will go there. So that can be there. But when there is just documents missing, this and that, then that is not the huge deal.
And as you mentioned, knowing German is very important, at least B2 level is required. So, is it feasible, someone can learn from India B2 and come here, or it's advisable to learn here only?
For a foreign doctor who is working in India or doing his internship, they have to complete the language course. And B2 is mandatory. C1 is preferred. If you have C1, it's good. Here I would say language you will learn when you are here. Okay. Before that, you will learn for the exam. So you can study. When I came here in 2014, I already had C1 from Goethe Institute in Pune. Okay, but the first day I went here, I did not understand anything that was going on. Okay, so irrespective of what language level you have done in your home country, you will be in cultural shock for first few months at least. Okay, and the language barrier, because the pronunciation, the accent, takes time to grasp. So that way, I would say that you will find the communication skills you will develop when you are here in Germany. But for that, if you want to come just for that, it's not a good idea because it will be expensive. You'll be wasting time. Because see, you know that living expenses are around for a single person, a student life, 800-900 euros per month is a living expense, right? So if he's doing 6 months of training language only, then it is like 5,000 euro or 6,000 euro have been spent just for the language, just for the living expenses, I'm saying. And the language fees is different. So in this time, one can do language in India, and this improvement can be done on Skype, can be done online. We have our language academy. We have trainers from Germany and from European countries work with us online. So we train our candidates like that. So it is not that for that you have to be here, because the costs are very high and also it takes time.
And just to add to it, so let's say someone has done B2 or C1, but when they come to Germany and work as a doctor, the medical terms or the technical terms are also in German. So is there any specific German course related to that, or some exam related to that?
Yes. As I mentioned, the temporary medical license. Before that, they have to take the Fachsprachprüfung. Now, Fachsprachprüfung literally means Fach means the subject, specialty, Sprach means the language. So specialty language test. So in German, German medical, you can roughly say medical German exam. So that is an exam which is conducted by the medical council in each state, and one has to pass that exam. So, and for that, one has to prepare for the exam. So that way one learns the terminology and everything, the system in Germany. So the passing rate for that is like around 50-60%. That means half of the people fail the exam in first attempt. But then good news is that one can repeat the exam like like multiple times without any limitations. So that way it is fine. Every time one has to just pay the fees, 350 euros or 400 euros, depending upon the state, and wait for 3 months to get an appointment. So that adds up to your cost, because if you're waiting 3 months, then 900 of living cost into 3 months, 2,700 plus the exam fees of 3,000 euro, you are in negative if you failed the exam once. But nobody fails the exam like purposefully. So if you fail, it's not end of the world.
So, what's the exam pattern for this Fachsprachprüfung? Yeah.
Exam pattern, it has 3 sections. First is the Anamnese, that is the Arzt-Patient-Gespräch, that means a doctor-patient conversation, basically history taking. That as you go in the hospital, doctor asks you, okay, what is the problem, since when? So that is of 20 minutes duration. So, and then the second, after that, and from this 20 minutes, the patient will ask you questions also. Okay, doctor, what do you think I have? What is your next plan? What examination do you want to do? What test do you want to do? So the patient-doctor communication. Second part is the documentation, that all the history that you have taken, all the things that you have noted, you have to write it down in a proper Arztbrief, a letter, a doctor's letter, summary basically. And the third part is the Arzt-Gespräch. So Arzt-Gespräch is the doctor-doctor communication, which is like you are presenting the case to your senior doctor. That, okay, I saw this patient, name, age, so-and-so, these complaints. So the difference in these conversations is that when a doctor talks to the patient, he talks in patient's language. That is a simple German language. And when the patient and the doctor explains it to his senior doctor, he talks in a medical language, medical German language. So they judge these things, and when you write it, then they check your writing skills, that if you can sensibly write everything. So this exam, as I said, each section is 20 minutes. Some states have some variations in their exams, like some have translations, some say sometimes the doctors get phone calls and they try to simulate the normal hospital scenario. Okay, in normal hospital, when we work in the hospital, like we get a phone call that, okay, this patient has this and this. Now, how will you respond to that call? First of all, are you understanding everything that has been said on the phone? And if you've understood, then now what are you saying? So this is what is tested in those exams. So it is not very long. It's like 1 hour totally, 20 minutes, like 3 sections. But as I said, one has to be prepared for the exam. There are courses available. There are online courses. We also have courses, and there are offline institutes which offer these courses, so one can enroll with them.
So we hope that you found this video informative and helpful. We also have our follow-up video wherein Dr. Deepak would be explaining about how to find hospitals, what is the application process, how is life of doctors and dentists in Germany, and what is salary range for them. So stay tuned.
So if you are really considering to pursue your medical career in Germany, then we would recommend you to check Dr. Deepak's website. The link is in the description. He also offers online courses such as Roadmap for Doctors in Germany, Roadmap for Dentists in Germany, FSP to KP, and much more. So if you have liked the video, then do like the video. If you are new around here, then do consider subscribing our channel as well as Dr. Deepak's channel. And we'll see you in our next video. Till then, bye.